pleased to be here today to present highlights from a retrospective study examining antimicrobial use in Canadian feedlot cattle. This important and timely study has provided insights into indications for use, risk factors for treatment, and the impact of how different metrics are used to quantitate AMU and can alter the interpretation of the data. This study was undertaken for several reasons, and primarily there was a need to improve our understanding of the feedlot industry's contribution to the total consumption of antimicrobials, especially those classified as important to human health. It is also necessary to have accurate, robust information on AM exposures for the feedlot sector risk analysis and assessments, and these exposures may relate to the potential for contamination of beef products intended for human consumption. And by understanding how AMU may change over time, as well as when and where, and how feedlot cattle exposed to antimicrobials, there's an opportunity to identify interventions to modify use of those products. And I think that other speakers here have emphasized that finding meaningful metrics is difficult in this field. Other than using kilograms of antibiotics sold and trying to relate that to the population at risk. And so this study is attempting to look at the very precise metrics and measure exactly how much antimicrobial was used in those various populations over time. So this is a fairly large study. We have 2,615,082 cattle from 36 feedlots across Western Canada. The data represents 4 years of arrival placement cohorts from November to October in 12-month cycles starting in the fall of 2008. And we have all of the data for each placement cohort from arrival until exit from the feedlot. The parenteral AMU information was collected into a chute-sized computer information system, a proprietary system called IFHMS, and the in-feed antimicrobial usage was collected from the feed records, micro machine usage reports, medicated feed prescriptions. In Canada, the use of medically important antimicrobials, MIAs, was done under a veterinary prescription issued by a licensed veterinarian operating under a VCPR. As I'd mentioned, there's a one-time capacity in these feedlots. We have 36 feedlots, and this slide is demonstrating the relative size of the feedlots and what contribution they were to the overall population. And the feedlots are divided into capacities of greater than 25,000, 20,000 to 25,000, 10 to 20,000, 5 to 10,000, and less than 5,000. And the larger feedlots, they represent only 14% of the facilities. 15 of 36 of the feedlots enrolled in the study contribute over half of the cattle contributed in each placement cohort. So this slide is breaking down the 2.6 million head into some descriptive statistics. The animals were characterized as calves, 45% of the population, and yearlings at 55%, males 63%, females 37%, season of arrival, fall or winter 62%, spring or summer 38%, and then the risk category for BRD of the arrival cattle, 39% of them would have been considered to be high risk animals related to their age and time of year that they're moving into the feedlot, and 61% would have been classified as low risk cattle. So these sides get a little busy here, but what we're attempting to illustrate here is that there's a number of different approaches that can be used to quantify the antimicrobial use. And this study routinely employed the number of animal used daily doses, since the actual dose of the drug administered is in the data collection system, and the animals were weighed prior to treatment, so that the dose that is recorded is the exact dose. And the concept of animal daily dose is introduced by the World Health Organization to address the need for an AMU metric that considers the potency and duration of effect of the AMD and allows for comparison across species and different types of antimicrobials. 1 ADD represents the milligram amount of antimicrobial required to dose one animal of a standard weight for 1 day. And the number of animal used daily doses is equal to the total milligrams of antimicrobials divided by the standard milligram per kilogram dose, multiplied by the standard population weight in the study. So the data presented here demonstrates that both parenteral and in-feed antimicrobial use in animal daily doses divided by 100,000 head in each placement cohort. And as you can see in this data, over time, there was a reduction in the NAUDD, both parenterally and in feed, 5.5% reduction in parenteral, and 14.3% reduction in feed during the study period. So one is that this data is very accurately quantifying the amount of antimicrobials that are being used. And in addition here, there is, over this time frame, a reduction in usage in the system. The feed reduction is caused by a change in practice where, based on large-scale field trials, metaphylactic drugs, it was shown that the use of chlorotetracycline could be removed from the feed when metaphylaxis was utilized, and this has resulted in a decline in the amount of in-feed antimicrobials. And on the parenteral side, you can also see a slight reduction over time, and this is a result of several factors, and it includes changes in vaccine protocols, biosecurity procedures, sick animal detection, improvements in metaphylactic and therapeutic protocols, and better risk assessment algorithms. All of these changes have been supported by large-scale field trials, and as you can see here, have resulted in the decrease in parental antimicrobial usage. While this can be interpreted as improved stewardship, it is also essential to note that it improves the overall system and reductions in morbidity, mortality, along with improvements in animal welfare at the same time. So nice trends there showing reductions in that time frame. This slide here, again, a little busy, but it's difficult to find ways of presenting some of this information in one slide. If we're looking at the types of antimicrobials used, you can see that tetracyclines, the most frequently utilized, and then fluoroquinolones were administered the least frequently, with decreases in both over time. And there was an increase in the use of fluorophenocal over the 4 placement cohorts, and this coincided with the licensing of a combination product of quinolone and flunixin in 2007. And on a relative efficacy, this new product compared to other antibiotics used, so greater than 80% of macrolide use was attributed to erythromycin, and it's not surprising given that the published literature clearly indicates that this drug is the most efficacious macrolide to use for BRD treatment and control, and 92.6% parenteral AMU was prevention, control, and treatment of BRD. Since one of the outcomes of the work was to consider the impact of various quantitative measures of AMU, the figures on this slide provides a comparison of the total NAUDD biomass at risk of exposure for 3 different biomass estimates. And in this calculation, the AMU is calculated by using the total number of female cattle and multiply it by the actual weight at time of exposure for the first bar, and then multiplying the total female cattle by the mean weight of 356.3 at time of treatment for the second bar, or multiplying it for the third bar by the European standard average of 200 kilograms at treatment in the third bar, right? And you can see here that what it does represent is the danger of using the standardized treatment weight for heifers when the population that in this population was a heavier group. And I think that was talked a little about earlier in the earlier presentations about what's the actual weight of the animal that's being treated. I say in this data, we have the luxury of having the actual body weight of the animal. And so over or underestimation needs to be considered when contemplating the comparison of data produced using higher standard weights, such as slaughter weight, to the data using lower standard weights, such as exposure, weight at exposure, weight at treatment, or weight at arrival. Time of exposure, and then here showing that the European number would have given a significant overestimate of the usage in this population. So to summarize some of the major outcomes of the product of this particular study, decreasing trend of in-feed and parental AMU over time. In-feed AMU, 97% of the animals received in-feed antimicrobials at some point. Ionophores, which are non-medically important, represent 89% of feed AMU, with monensin used in 99.9% of the cases. Macrolides and tetracyclines were the main classes of MIA used in the feed, and in-feed tylosin was used to prevent or control liver abscesses. In-feed tetracyclines were used for 2 main indications, one to prevent and control liver abscesses and to prevent and control histophilosis. In Canada, with the parenteral AMUs, Health Canada, the Veterinary Drug Directorate, has categorized them Category 1, Category 2, and Category 3 for purposes of the risk to human health that each product would entail. In this study, 92.6 of the parenteral AMUs were targeted against BRD. 90% of the BRD usage was macrolide and tetracycline use. And the choice of the AMU metric depends on goals of surveillance and availability of different types of data for the calculation. And in this data set, we have the actual average weight of the animals at time of exposure, at time of treatment, and this is the best estimate for monitoring the AMU. So when we monitor the actual AMU, it provides a much more accurate picture of parenteral and in-feed AMU and feedlot production than using the prescription or dispensing monitoring systems. And this is a robust system to collect parental AMU data, are widely used in the Canadian feedlot sector. And in many cases, the systems were developed or implemented by veterinary practices. The systems to collect feed data are also widely used in the Canadian feedlot sector. And there's most existing systems record the feed fed, not in feed AMU, but you can use this information, put it together, and calculate the amount of AM in the feed fed. So it would be nicer to have a direct recording system because that would facilitate easy summary and monitoring of the data. But certainly the systems and the mechanism exists to collect very accurate information in the feedlot sector in Canada and in other parts of North America. And I think that it's incumbent upon the veterinarians in the industry to collect this data, make it available, and see if we can have a rational discussion of AM usage and to develop the strategies moving forward of how to decrease antimicrobial usage in a logical and scientific way. But until you actually measure it accurately, it's pretty hard to have those type of discussions. You have to know where you've been before you can figure out where you're actually going to go. And this study clearly demonstrates that it is possible to collect this information in a very precise way and have that information available so that, say, moving forward when we're discussing different therapeutic approaches, different metaphylactic approaches, we can have a pretty clear idea of where that's going to put us and where that we need to go to make sure that we have the public trust as veterinarians for judicious antimicrobial use, and that we don't have any untimely and unnecessary restrictions on the use of antimicrobials in food animal production. Thank you for your attention.